Welcome back. A very serious discussion we need to have around cancer treatment and the cost thereof. Well, treatment here in South Africa often depends on one's social and obviously, of course, economic status. Essentially, if you can afford the treatment. Access to health insurance and also geographic location plays a big part. Access made worse by poor infrastructure and resources at our public health facilities. Well, the Johnson Rose Cancer Foundation is aiming to address these disparities by providing vulnerable, uninsured patients, those without medical aid or any kind of payment plans, with treatment and support services. So how are they doing this? And let's talk about the initiative. It's a pleasure to welcome to the show founder and director of the foundation, Dr Sudeshen Naidoo, joining us this morning. Doc, good morning to you. I appreciate your time. Allow me to start by just reading a statistic I've seen from johnsonrosecancer.org that 85% of the uninsured population are serviced by only 15% of oncologists in the public sector. That's a terrifying stat for those struggling with cancer, isn't it?
Yes, good morning, Gareth. And unfortunately, in South Africa, the cancer crisis has become insurmountable, where treatment and care is disproportionately associated with socioeconomic status, access to health insurance, and geographic location. And that actually is made worse by decrease in resources in terms of oncologists available in the public healthcare sector. And as you said, that 85% of the population is only serviced by 15% of the oncologists, and vice versa. We have 15% of the insured population being overserviced by 85% of the oncologists. So this basically creates a bottleneck and long waiting times to access cancer treatment in public healthcare facilities, in some cities more worse than others. And this actually causes people with preventable deaths to actually have cancers that progress and essentially succumb to death. So the Johnson Rose Cancer Foundation is the first in South Africa and in Southern Africa to actually address some of these disparities by a multi-pronged approach. And firstly, we want to try and increase the number of oncology training specialists within the public healthcare sector and try to retain them in the government hospitals to provide more access to cancer treatment. Secondly, because of high treatment costs of cancer treatment like radiotherapy and chemotherapy, most patients with lack of financial resources are unable to access the standard of care treatments. And that brings up about inequality in care. So we would like to address that by trying to assist and fund these partially insured or uninsured patients and bring them over onto a section with the help of private healthcare organizations, private healthcare facilities, with the help of government, other NGOs in the cancer space, and with the academia that's involved.
Doctor, I'd like to just ask you about the funding of this. I know you're about to make another point. I will circle back around because I think many people would be curious to know how it is that your foundation is able to do this, because cancer treatment is not cheap. Talk to me about the funding. How does that work? I know someone's trying to phone you.
Unfortunately, I'm on call. So basically, the funding, the Johnson Rose Cancer Foundation is a non-profit organization, and we rely on donations in order to actually provide this funding for patients and their families afflicted by cancer. So we need the South Africans to help us help everybody, because we are dependent on everyone to assist us. And donations can be made to the foundation. And from there, we will actually sit in a panel and then actually distribute those resources depending on those three objectives in terms of increasing the number of oncologists, treating uninsured patients that are on long waiting lists, and helping support families afflicted with cancer. And I mean, personally myself, the reason why I became an oncologist is my mom's sister passed away at a very young age with a very aggressive cancer. And again, in 2019, my dad, who was a medical physician, passed away from a very aggressive cancer in a very short space of time.
Sure.
And as an oncologist, that was a very tough thing to see, to witness. And I mean, he had all the available resources available being a medical specialist. And seeing someone suffer like that is never a good thing. And I always thought to myself, if we are in this lucky, privileged position, what do the people out there, what does the general South African without medical aid actually does? And this is the reason why I felt so strongly to honor these people, my father and my auntie, by starting up this foundation and asking the assistance of South Africa to help us help everybody get the proper access to care that they deserve and they should be getting.
And Doctor, and hopefully now off the back of this discussion, I know it's been very brief, and hopefully people have heard what is needed and how you're able to help. If you're able to do it for me in about 10 or 15 seconds, somebody thinks they may need your assistance or is able to assist. As I say goodbye, because I also know you're on call, Doctor, where do they go?
So simply go onto the website, www.johnsonrose.org. and can get hold of us there. So that's our website with all the email addresses where one can see what our approaches are to helping people, for donations, and to connect with us. So anybody in South Africa that wants to connect to help us, NGOs, general South Africans, corporates, we are hoping that everyone can be with us in this to help this crisis, because it is a human rights crisis that we are dealing with.